Our first guest today is Dr. Philip Brown, Novant Health's Chief Community Impact Officer. It's so nice to have you with us today, Dr. Brown.
It is great to be here.
I'm excited to get to know you. I know that you're with New Hanover Regional Medical Center, and you're now part of us. So let's talk about a little bit about your background. Tell me where you went to school and how you became a doctor.
So working at New Hanover Regional was a trip back home for me. I'm a Wilmington native, graduated from New Hanover High School and UNC Wilmington in undergrad. And then I went to East Carolina for my medical school and my general surgery residency as well. Then I took a little detour up to Baltimore, Johns Hopkins University for my vascular surgery fellowship, and then spent 2 years on faculty at East Carolina as assistant professor of vascular surgery. But in 2004, I had a chance to come back to New Hanover Regional and come back home. And it was so nice to be able to come back home and take care of the folks that I grew up with.
Yeah, we have we've had several guests on the show who have grew up here and went away to school but came back to take care of their community. So that's really nice to hear.
It's really rewarding. Sometimes it's tough depending on the nature of what you're taking care of, but there's really nothing like practicing close to home.
Yeah. Well, I would really like to talk about your new role as Novant Health's Chief Community Impact Officer, and that's our very first one, I believe.
It is, and I'm so excited to have the opportunity to do this because it's so aligned with the mission of Novant Health. I mean, when you say that we exist to improve the health of communities, one person at a time, right? I mean, and so this is a chance to say, okay, well, let's make sure that health of communities really is improving. And part of my role will be to help define that, to get the metrics around it, to really understand, not just are we helping people one at a time, we know we're doing that, we're really good at it.
We are.
The remarkable patient experience in every dimension, every time is a real thing that we do well. But looking at how the health of communities improves is a little bit more complex. So that's one part of the job of several others.
Well, we at Novant Health like to say how we go outside our walls. We don't just practice within our walls. We go out into the community, into the homes, and where they are. You meet the patient where they are. So why do you think that's so important?
Well, I think we had a great example of it during COVID-19 when we tried to understand what it took to vaccinate patients, and when we looked at the patients that were getting vaccinations very early on, we were horrified because we realized it wasn't consistent with our shared driver of diversity, inclusion, and equity.
Right.
And so we had to reach out into the communities in new, different, and accelerated ways, and we did. And when we did that, we were able to really make vaccination equitable. And that was so rewarding, but it's really instructive of what the future is going to hold for us and how we need to be in the communities. And our health system is actually a member of each community that we serve, and understanding what it means to just be not only a service to the community, but a community member is really important. And it's really exciting to be a part of that kind of philosophy.
It is. I know you're part of Novant Health's diversity and inclusion team. Is that correct?
Yes.
And let's talk about health equity. We hear that buzz. That's just the new thing to talk about. Everybody's talking about health equity. Explain to me what that really means.
Well, in its simplest terms, health equity just means that every person has the opportunity to reach their highest level of health. And that's really what we're all about in terms of taking care out into the communities, in terms of really that inclusive environment that we have, being able to understand better what our patients' perspectives are so that we can really deliver that remarkable care in every dimension, no matter where they attach to our system.
In your past, have you ever been so involved with health equity and diversity and inclusion as you are with this new role?
Well, for the last 5 years as chief physician at New Hanover Regional, we really began that journey in earnest, and it was a very important part of our strategic plan, and it was a great part of our focus. what I'm really excited about in terms of being a part of Novant Health is that Novant Health has been on the journey longer. There's more experience there. There's an incredible opportunity to learn, to accelerate. There's no reason to think that our part of the journey will have to be at the same pace because we have the benefit of the system expertise. That's exciting. For me, this role actually allows me to attach to my sense of purpose in delivering health to all people just so closely. It's wonderful when your job and your sense of purpose are so well aligned.
Yeah, you're right. I think that I used to teach diversity and inclusion. When we first brought it to Brunswick Medical Center, I was one of the first instructors. And I can't tell you how much I learned. First of all, I thought I was very in tune to that, but I soon learned that I had a lot to learn too. But that's such a rewarding experience, and you have such great conversations with your employees, and then to act on those and to take it out into the community. But all of our employees here, all of our teammates, everybody goes through that same learning. And it's just been a great thing. And as you said, Novant Health is way ahead of the curve when it comes to health equity. And I noticed, I saw something on TV, and I believe it was New Hanover Regional Medical Center employees going into homes and giving vaccination. And that was the first I had seen that.
Absolutely, and I have to tell a story because
Absolutely.
Novant Health sponsored a 5K Sprint for Swimclusion race, which was a fundraiser, a fundraiser for a local swim nonprofit that brings free lessons into historically marginalized communities. And we as a system sponsored that event, and a vaccination event accompanied it. So we did that together, right? So we did a 5K race, but we also did a vaccination event for the community. And it just so turned out that we had 3 left over. And so I called a community member who's a close friend of mine, another high school contemporary, and she sent me to a place about 5 blocks up from the start finish of the race. And when I walked in, I immediately recognized the patient because I'd known him since I was 7 years old when he was playing high school basketball for my father. And it was so rewarding to really make that connection. And he actually went back into a room and brought out a picture of that basketball team from the 70s and showed it to me of himself and the rest of the team that played for my father. So it really is about getting into the community and those levels of trust, whether it's the one-on-one or whether it's the things that we did in churches and community centers where we really take that care to the patients. And the same thing with the Michael Jordan clinics. We're really listening to the communities about what they need to have, be a part of it, and what they feel like the health needs are. And we're going to do our level best to meet those in the communities we serve.
Speaking of those clinics, I'm so excited about that. It's going to open up doors to so many people for such needed care. The one in Charlotte is so, it's just so successful. People love it. So we're real excited to see that happen in Wilmington. There's a great need there. So this area is so large and it's very diverse. It's both rural and cosmopolitan. How do you see the growth here? How are we going to bridge that gap between rural and say Wilmington?
Well, it's going to be a great challenge, but we have wonderful partners. We have in existence some magnificent parts of the system. We have practices in many different places. We also have the new relationship with the UNC School of Medicine.
I'm glad you brought that up.
And that is going to open up all kinds of doors for our community. And the other thing that I'm really excited about in terms of that is the expansion of training programs locally, as well as with Novant in Charlotte, there's some expansion of training there with that part of our health system. And so it's going to give us opportunity to have people who we train stay here and continue to serve our communities. And we really know that's how it works.
I love that.
It really is.
I think having UNC as a partner, it'll be a pipeline for us to get new physicians or physicians to stay in the area, because once they do their training, if they've had children here, they've put down some roots, it'd be nice to be able to offer them additional positions. And we're looking forward to what it will bring to Brunswick Medical Center, because we haven't had the benefits of having a residency program or very many medical students and what have you. So I think it's going to be hugely important for Brunswick.
It is, and you know, the other thing that it also allows is going to be a focus on our healthcare provider workforce. One of the things that we really need to do, and it's a system effort all across the system, is to really get our workforce to very closely resemble the communities we serve.
Exactly.
And so another focus of my role is really helping develop some of those plans for healthcare workforce pipeline development, right? So how do we really, in our particular regions here at the coast, but really centrally as well, we know that we actually need more African American providers. We need more Hispanic providers for sure. As we get out into some of the more rural areas that we serve here, we need Native American providers. And those are things that we're really dedicated to pursue over the next decade. We intend to be a leader in that, just like Novant Health was the first recipient of the Health Equity Award nationally.
Right, they were.
And so, you know, we can lead in the provider space as well, and that's really all healthcare careers, because we know team-based care is what it's all about. And the diverse and inclusive environment that we're creating sets up beautifully for team-based care at its very finest. So that's something I'm truly excited about.
Me too. I cannot thank you enough and tell you what a pleasure it's been to have you on the show today. I want to definitely have you back soon. I think you have so much more to say, and unfortunately we just don't have the time today, but you will come back, right?
Absolutely. I'll be here a lot. Thanks for having me.
You're quite welcome.